The ever-rising cost of health insurance. Who stands to gain? The ever-rising cost of health care and health insurance affects everyone. The increasing insurance premiums reduce the contributions by the employer. The rising deductibles and coinsurance, and also out-of-pocket maximums, force the policyholder to pay more money out of their own pocket. Carriers are reducing physician and facility reimbursements and overall paying less for medical services and procedure. My conclusion is that greater regulation of insurance carriers' policy and procedures would result in less financial responsibility for employers, members, and providers. Analysis of data shows concerns in three major areas. Premiums. The cost for group health care is anticipated to increase by 8.8% for the year 2011. This is the largest increase since 2005. The increase for individual health plans is much greater for the same year. Decreased insurance benefits. Insurance carriers are reducing the policyholders' benefits by increasing the deductibles, coinsurance, and out-of-pocket maximums that the policyholder is responsible for. Provider reimbursements. The amount that the healthcare provider is being paid to take care of a patient is ever increasing. The reduction of these payments results in increased amounts being billed to the health insurance carrier. On the basis of these concerns, it is recommended that regulations be placed on health insurance providers to limit and prevent premium increase, benefit decrease, and reduction of provider reimbursements. Health insurance and the lack of coverage. The study analyzed the increasing cost of health care insurance and the reduction of coverage for policyholders. It also looked at the ever-decreasing reimbursement to providers versus the increasing cost to provide health care. Why are premiums for health insurance dramatically increasing? What is the cause for this? What is causing the reduction of overall health care benefits? And why do healthcare providers charge more money every year for the same office visit? Background. Rate increases are causing employers to cut back on health insurance. In 2006, just fewer than 16% of all Americans did not have health care. This was increased of an overall of 1 million from the year before. The number has increased every year since. What was the cause of this increase? Was it a steady increase in the premiums being charged by insurance carriers? In order to offset some of the increase and prevent the employees from having to pay additional cost of the insurance, many employers agreed to increase deductibles and coinsurance maximums. This may have seemed like a good idea at the time, but increasing these deductibles and coinsurance actually increased the amount the employer was responsible for. With premiums increasing, still many businesses are no longer providing health insurance to their employees. Of the ones that are, higher employee contributions and deductibles are now the norm. Healthcare providers have issues of their own. Not only do they face the same problems as employers, but they are also being reimbursed less every year for treatment of their patients. In 2011, Medicare will once again cut reimbursements to healthcare providers. This is causing many providers to limit the number of Medicare patients they see, and some are now refusing to take new Medicare patients at all. Analysis of the findings. The study indicates the areas that can be remedied both immediately and in the long term. These remedies will require the cooperation of the employer, the healthcare provider, the policyholder, and federal and state governments. The remedies fall into two categories: immediate or short-term and long-term. Immediate remedies. All health insurance carriers should offer wellness programs to employees. The wellness programs should include incentives such as premium reductions, lower deductibles and coinsurance responsibilities for the policyholder, and rebates for the use of fitness centers and martial arts studios. These wellness programs should also focus on the benefits of healthy living, with incentives being the rewards. Roughly 87.5% of all healthcare costs are due to a person's lifestyle. This will result in significant savings to the employer. For the healthcare provider, the immediate remedy is not as easy. Immediate limitations should be placed on health insurance carriers regarding the payment reductions that they apply to medical claims. Intense investigation of health insurance carrier policies and procedures should be implemented. These policies and procedures should be made available as public record for anyone to access. After a time period of 2 to 3 years, the federal government should phase out the current pricing procedure of health insurance carriers. Preferred provider organizations should be disbanded. Once these PPO networks are gone, patients will have far greater access to health care. A fair and reasonable fee listing should be made uniform to all commercial carriers and available to the public for review. Government regulations should also be put in place to prevent the current situation from occurring again. In analyzing the health insurance and the costs associated with having insurance coverage, it is apparent there is not only one victim. The rising cost of health insurance has affected employers, employees, and providers. That leads to the following conclusions and recommendations for remedying the issues. Insurance carriers should provide wellness programs that, with the participation from the employees, will result in significant premium reduction. These wellness programs should also allow for deductibles and coinsurance reduction over time. Limitations should be placed on health insurance carriers regarding the amount of reduction they can place on a provider's claim. Strict regulations should also be implemented to prevent the insurance carriers from penalizing the patient or provider for non-network participation. On the basis of this study, I recommend these changes be made to benefit the employer, the employee, and the healthcare provider.